Good morning, everyone. My name is Carrie Barber, and I'm the Director of the Bureau of Education and Transition Support Services in the Division of Youth Development and Partnerships for Success. Thank you, everybody, for joining. I do want to extend some greetings also from my Deputy Commissioner, Nina Aladort, who unfortunately was not able to attend today, but she definitely wanted everybody to be welcomed and, sends her regrets. So just to make sure everybody is in the right place, because I understand that we have a large group here, and please note that we have done mute upon entry. This session also is being recorded for those who are not able to attend. But we are going to be talking about the transition plan overview and the changes that have been made to the transition plan document for youth in foster care. So if you happen to be in the wrong place, now would be your opportunity to move on to a different one. If you're in the right place, great and welcome. I'm going to go ahead and get us started. And starting with just an understanding that the transition plan obviously is our focus here today. We are going to be kind of grounding it in the basics of the importance around youth voice. And you'll hear in our next slide why this becomes such an important piece. We learned through focus groups that we conducted back in November of 2023 with individuals in foster care and recently out of foster care between the ages of 14 and 21. Their thoughts on, what they said about the transition plan. And I just, I'm going to read through some of these because I do think that they're, incredibly important to hear the perspective from the youth that we heard youth are not aware of that the transition plan actually existed. I never had a voice in my plan. The plan was created without my involvement. The plan was just read to me. The plan was completed at my discharge date. It was a formal process, not a discussion. I only saw a copy when I left care. And then obviously the other is that a plan they have in mind when you move out? So it's clear that we have many young people who do not necessarily have involvement in creating and developing their own transition plan. And that's why we really wanted to put a strong emphasis and focus on youth voice. And to start with, I also want to talk a little bit about the National Youth in Transition Database. And this is essentially what I would call the foundation of data that's collected. And we report this to the federal government every year. And it's information, obviously, that we learn about youth while they're in the system, while in foster care, as well as after they've exited the system. So we collect different data through surveys from these individuals, starting at the age of 17 when they're in foster care. We follow those same individuals at the age of 19 and again at the age of 21 to see, what their outcomes are actually looking like at that time, when they turn 21. So you might be asking, why is this actually connected to the transition plan? And obviously, just a minute ago, I mentioned the importance of youth voice. And we see that the transition plan actually is a key tool in preparing youth to exit foster care successfully. And obviously, the United data outcomes also give us information to say that we have a lot to improve on when it comes to the outcomes of our older youth in foster care and those who are exiting successfully. So just also to let you know, the purpose actually of NIDED is to continually assess outcomes for youth transitioning out of the foster care system, and that we're collecting and reporting data regarding independent living services for youth in transition from adolescence to adulthood. I will point out that NIDED is a two-component piece. So I mentioned that our outcome information comes through surveys. from 17, 19, and 21-year-olds. And the independent living services data that we collect comes from the connection system and what is recorded in the FASP related to independent living services being provided to young people ages 14 to 21 while in foster care. I want to talk briefly about the different kind of key elements of NIDED that are collected via the survey. And this is data that is from what we refer to as cohort 2, which started for 17-year-olds back in 2014. And this group would have finished up as in 2018 when they were 21. And then we have also data from cohort 3 that started being collected through surveys in 2017 and finished in 2021. We do not yet have a completed cohort 4. Cohort 4 started in 2020 and is finishing this year in 2024. So we are still in process of collecting surveys from 21-year-olds through 2024. And that's a federal fiscal year. So the high points of what we're really wanting to focus in on as far as outcomes that we get from our NIDED data is around financial self-sufficiency, employment information, higher education, adult connections, homelessness, and parenting youth. So let's start with the financial self-sufficiency from employment and what it actually looks like for 21-year-olds. So for a 21-year-old in 2018, so 2018, we had 54% of our 21-year-olds who were surveyed reporting that they were either employed full-time or part-time. Now, I want to point out that in our next cohort by 2021, our 21-year-olds, this decreased 11% down to 43% of our individuals indicating that they were employed either full-time or part-time. You can, probably surmise that some of that may have to do with the pandemic timeframe as to why we're seeing a decrease percent of employment, whether it's full-time or part-time for our individuals who are 21. And by 21, I do also want to point out, this would be surveys of individuals who could have been still in foster care, but the majority of these individuals are also by this point out of foster care. On our education outcomes, we have also from the same cohorts of data, we're seeing that it took longer for our young people to actually receive their high school diploma or their GED by 2021 rather than the group of 21-year-olds in 2018. For those in 2021, they were less likely also to be pursuing higher education than those individuals who were 21 in 2018. And just to point out that at age 21, only about a third of the youth are actually enrolled in some sort of educational program, which is suggesting that most of our youth who are aging out of foster care do not go on to pursue any kind of higher education, which would include a trade or vocational program. Adult connections. And, when you look at this just on the side and you see 92%, obviously that looks like a great percent. And this is at the age of 17 of surveys. And this is our cohort 3, which would have started in 2017. So at 17 years old, we have 92% of our individuals being surveyed who are in foster care, reporting that they have a consistent adult in their life other than their caseworker that they could go to for advice or some sort of support. But by age 21, this percent has gradually declined to 86%. Now, if we had the ability to survey beyond the age of 21, we might also see that this is even lower percent for those individuals now who might be 24 or 25 years old. As far as homelessness, this has been a consistent category where we have seen a high percent of homelessness from the very beginning of when NIDA data started to be collected. I do want to point out, obviously, homelessness of youth who are exiting foster care is a serious issue. Um, the percent of youth that are reporting being homeless has remained at the same levels. And, we're saying here since 2014, that's from cohort two. But I will be, clear to say that this same kind of information and percents we have seen since the beginning of NIDA data collection, which would date back to 2011. So we see at age 17, and I want to let people know that the question on the survey at this point is, if have you ever been homeless, at age 17 is the question, versus at age 19 and 21. The question is, in the past 2 years, were you homeless at any time? And keep in mind that at age 17, the question that's being asked of these individuals is when they are actually in foster care. And we have between 14 and 20% of our individuals in foster care at age 17 saying that at some point in their life they have experienced homelessness. And by the time they're 19, we have 10 to 14% of our individuals saying that within the last 2 years, so since they were 17, they have experienced homelessness. And also pointing out that, the this age 19 and 21, some of these individuals are no longer in foster care. And, they could be saying that based on whether or not they're still in foster care or if they have left foster care. It's not a great percent. And obviously it increases, I would say, significantly at the age of 21, when you're seeing 20 to 23% of the population within the last 2 years since they were 19, indicating that they experienced homelessness. It's probably no surprise that homelessness is higher for females compared to males, and also does have a bigger impact on the LGBTQ plus population as well. So just to once again kind of make sure that everybody understands that, yeah, homelessness actually increases after youth leave foster care, which also makes the transition plan that much more important in planning for what their housing circumstances may be for when they do exit foster care. Parenting experience that comes from our NIDed data as well. The number of youth who are parents has tripled for both males and females from the age of 17 to 21. 27% of our females that are surveyed report parenting at least one child by the time they're 21. And once again, I want to point out that when we're starting these surveys at the age of 17, these individuals are in foster care. And then by the time that they're turning 21, we have 27% indicating that they are a parent, and 9% obviously at the age of 17 indicating that they are already a parent. I'll just also add that the transition plan does have a place specifically to address parenting individuals and making sure that the plans are all in place of what they may need before they actually exit foster care. So hopefully that we would see a change in the outcome data in the future related to the NIDed information. Want to shift gears a little bit now in regards to our data and focus in on who our youth actually are as far as who's in care. And this is data as of December 31st, 2023. And I have broken it out based on age 17 because that's the age roughly when the transition plan is actually starting. and we have 776 individuals actually in care, and that was as of December 31st of last year, with 99% of those individuals actually absent. The ages 18 to 21, you'll see that it's, over 1,300 individuals who are actually in care. This is the number of individuals we need to reach to do transition plans with, because this is the in-care population. So you're talking about well over 2,000 individuals that we need to be able to connect with to complete transition plans and work with them and have discussions about their exit from foster care. This is broken out by race, just information that you can see very clearly that we have an overrepresentation of African American youth in foster care compared to any other category here. The absent category, I don't want to leave them out because although they may be listed as being absent from foster care, there still needs to be transition planning completed with those individuals as well. And they fall into the overall numbers of over 2,000 individuals in care who would require a transition plan. To break this down a little bit further as to where we need to kind of, put our focus and attention and outreach to in regards to our youth who are in care starting at age 17. I've, you know, done this by facility type. So you'll see that we have the majority of our 17-year-olds are actually in congregate care level. So 46%. And then of note, and I would imagine in the future as a result of Family First, we're going to see the percentages rise of foster boarding home as well as relative home. But for the time being in this data, which was as of December 31st, 2023, we have the majority in congregate care. And out of the congregate care, you can see that 28% are actually at institution level or group residence. We have a very small percentage who are actually listed as being in supervised setting programs. And the other breakout here is for group homes and agency operated boarding homes. So our focus on this actually needs to be who is it that we need to be involving in conversations about the transition plan for youth. And at this stage when they're 17, it's at the congregate care level, not excluding that we don't need to be thinking about foster home or foster parents and relative caregivers. But we also very much need to be thinking about who is it at the voluntary agencies that need to be engaged in the process and the planning around the transition plan for our youth. This is a group, obviously the same information from the previous slide, but now focused in on the 18 to 21-year-olds. Again, it's as of December 31st. And the interesting part here to note is that we have a shift from the use of congregate care programs to foster boarding home programs, and the relative caregiver or relative foster homes are at the same percent as it was when they were 17. But it's interesting to see this shift from congregate care at the age of 18, 19, 20, and 21. We're seeing more individuals being placed in foster boarding homes at 44%, compared, and congregate care level is now at 37% compared to when they were 17. Congregate care level was at 46. So a significant shift, I would say, from just in one age jump. And just also to show this breakout, we have institution level is still at the highest usage for this age group, but we do see a jump in supervised setting programs for this age group being utilized, but still I would say relatively low. It's at 8%. Our group home usage for this age group is at 8% as well, and agency operated boarding homes is at 7%. So now we have to shift our thinking about now who needs to be involved and thinking about the transition plan for our young people at 18 to 21. Because although, yes, we still need to make sure that we're communicating in the agency, voluntary agency level, but now we have more individuals at a foster boarding home level. So we probably need more conversations also now taking place with foster parents and making sure that skills are being received at that level, as well as that a transition plan is able to be completed while they're in foster boarding home and or relative homes. Just to walk through the time frame of the transition plan, this hasn't changed yet. And I will point out to you that, the biggouest thing, or one of the things that we heard very clearly at our focus groups, and we've heard it beyond the focus group, we've heard it at speak outs, we've heard it in individual conversations with young people. It's too late to start a transition plan at the age of 17 and a half. And I think the number one reason that kind of struck us is that they're indicating we're almost out of high school. And, now you want to start talking to us about actually planning for our future as to where we're going to live, what our education may be, as far as options available to us. And we're already out of high school or potentially almost completed with high school. And, it's a very valid issue that we need to start paying attention to, that it is too late to truly begin this. So we did put a pretty strong focus in our policy, the newest policy that is out. If you have not seen it yet, it is the OCFS. It's 2024 OCFS ADM-01. So it's the first policy issued in 2024 for the transition plan. And, it does highlight there that transition planning does not need to wait until, somebody is 17 and a half years old. It can actually start much sooner. You can start it when they're 14. You could start it when they're 15. Um, because clearly our youth are telling us, don't wait. Don't wait just because the guidance and the, legislation right now that's available says this is when you're supposed to start it. They want to have this started obviously way sooner. So I do want to walk through that just in general, though. Right now, it is required to be completed at starting at 17 and a half. And then at 17 and 9 months, it's supposed to be completed. So this is the initial plan, is supposed to be completed by 17 and 9 months. So that's for the individual youth. 90 days prior to their actual, or 90 days prior to their actual scheduled discharge. Because that's the other thing that I will point out in current policy and legislation is that the transition plan could be waited until you know when their scheduled discharge date is. And some people may say, well, their scheduled discharge date isn't until they're 21. So I don't need to start this until they're 20 and a half. And I come back to this conversation that you see at the very bottom of this slide is that it's too late. Please don't wait until somebody is 20 and a half years old to start a transition plan, because that's when they're scheduled to discharge. Also because it's known, very well known, that it is by consent for young people to stay in foster care once they turn the age of 18. And at 18, you may think because they've said that they're going to remain until they're 21, does not mean that they will actually stay. They could actually, walk away at any point in time. And if you didn't plan earlier to help them transition, they're walking out into, something where the outcomes for them are not likely to be successful. But just to finish this process, by the time if we do start it at 17 and a half, 90 days prior to them turning 18, it should be completed. And 30 days prior to them turning 18, they actually need to be given a copy of the initial transition plan. This is just to show that there are updates and reviews that should be taking place every 6 months. So if you're starting this at 17 and a half, the first one is completed by the time 30 days before they're 18, and the next one would be completed when they're 18 and a half, and again at 19, and so on until they're 21. If However, it started sooner, starting at 14, 15, or 16. Please note that you would also be doing it every 6 months thereafter to do a review and an update. This is maybe a good time also to mention that the review and update, and I'll mention this probably more than once, this new document that is out is expected to be completed by every single youth, regardless if they had an initial plan previously. So if you've got somebody in foster care who is 19 years old and you already have an initial transition plan that was completed for a youth using the old form and template, you would need to use the initial um, template that is now the new transition plan and not start with a review and update. You would be starting with the actual new form of the initial template. It does have a brand new look, the transition plan. It is required for all youth, meaning starting at the initial. And if you've had a chance to take a look at the policy that was issued on January 30th of this year, you'll see that it really does have a brand new look to it. It may look as though it's more labor intensive for a caseworker. I'm going to say this shouldn't be the case because this is meant to be geared to be youth voice and youth perspective. And also to say that it's not a one-time event. This should be an ongoing kind of living process for the youth to, have discussions about while they're in care. So the new transition plan, the form number for it is OCFS 5112, and it consists of several different parts. It has a demographic section. I don't think that that's different. It may look different than what it previously used to be. Um, what is different here is that we have a checklist part, and we start with that, and it's broken apart into two different pieces. And we'll walk through a little bit of what those sections actually look like. We also have what's referred to as kind of specified topics, and it's 7 different sections of specified topics. Also available as part of the transition plan is a glossary. It can be used to be given out to the actual youth because this is, meant to be, something that they can utilize to look up terms if they don't understand what something means, or also for the worker to utilize if they don't understand what a particular term means. So that is available as well as part of the transition plan. And we have also a brand new resource guide that does provide links um, to different resources that would be available. And that also has a form number as well of being OCFS 5111. So those are the different pieces of the transition plan now. So if anybody out there has the old template and update or amendment kind of document or forms saved to their computer, I would ask that you please delete them because they will no longer be utilized going forward. So we'll spend some time here talking about the different specified topics. And so, and I will also point out that this is very intentional to kind of use first person language. So my housing goal, my education vocational plan, adult connections in my life, community resources and supportive services, a safety section, workforce supports and employment services, and a section regarding family planning. It certainly, will help here to kind of walk through what an actual transition plan is. And it is a continual conversation with the youth that's completed over the course potentially of several months before they actually discharge. And when we talk about it being over several months, that's because you have the initial document that gets completed. And then every 6 months, you're continuing conversations about where you left off, because there's going to be some things from the initial plan that still need follow-up. So you're going to always kind of be referring back to that initial plan and taking a look at what were the blanks that have been left, what needs to still be completed, and at the next review or update. So it's always a conversation that needs to be taking place until they're actually discharged. And they shouldn't necessarily be formal conversations. It's not like, okay, today's the day we're going to sit down and we're going to do our transition plan. One, it's not our transition plan, it is the youth's transition plan. They need to be, you know, bought into this. They need to understand as well that this is about their future, and making sure that they're actually identifying a plan for themselves that they feel is going to be feasible and would actually help them. It is a living document, meaning it can be changed. So you might put something into the initial document, and then 6 months or a year down the road, maybe some of those things have changed. Or maybe you leave some blanks in the checklist part in the initial document that need to be revisited at an update or a review because the information just wasn't obtained or it wasn't known enough by the youth to fully understand it. So it's going to be what we would refer to as a living document. But here's what the transition plan is not. It is not a clinical form. It's not a set of actual just target dates. Although we lay out when it's actually due, I do want to point out that, it doesn't have to be specifically, you know, um, I have to do this, making sure that okay, my youth is turning 18 and a half and I have to start this on this date to make sure it's finished 30 days before they're, 18 and a half. I wouldn't get hung up on target dates around that, but just know in general that we're talking about every 6 months that we should be revisiting it. And during those 6 months, you're probably having conversations because you have casework contacts that are taking place with the young people. And everything in those casework contacts should be talking about at this point, because of their age, what their future is looking like. And it will eventually inform what their transition plan also should be looking like. This is not an exam. It's not a test for the youth. It's not meant to be a pass fail kind of situation. Well, you're supposed to know this by now. That's not the case. This is a process and a place for them to actually get to learn some of the things that they need to know about before they actually exit foster care. And most of all, I'm going to point out that this is not a form to actually be completed by a worker. So please know that we've run into this in the past where we've been asked repeatedly to think about having this document or this form part of connections. We have purposely chosen not to make it part of connections because that would mean that the youth would not have access, and that would mean that we don't have actual youth voice and input into the document then. We will talk about the necessity of the document needing to be uploaded into connections. So I think one of the things that you will, find in the new form as far as changes is that it is first person language throughout the form, meaning first person from the use point of view. They can be sent the form in advance so that they have an opportunity to review it and think about any questions that they may have during, the time that they do get together with the worker to discuss. Because there's different sections that might have more meaning to some youth than others. Um, but it is going to be something that is completed over a series of meetings between worker and youth. And as I just said previously, that it's not a form that is part of the connection system. So it's not something that we're planning to do because it obviously doesn't allow for the youth voice, and we don't get their perspective as much if we make it embedded within the connection system. The other pieces that are significantly different here is that we're going to find a section for rating, the youth rating piece, in after each one of the 7 different specified topic areas. And that's for the youth to decide kind of where do they see their readiness and how prepared they actually are to leave and exit foster care. And it's not meant to be a rating of what the worker thinks the youth's readiness is. It is truly just what the youth thinks their readiness is. They rate themselves the highest, they rate themselves the highest. They could be challenged on it by, a worker, foster parent, whomever, to kind of say, how do you think that you got yourself to this, state of readiness in this particular area? But overall, I want to really emphasize that the rating part is about the youth being able to say for themselves, this is where I see myself in regards to readiness. Um, we have talked about that they, actually, I haven't talked about this. They are entitled to assistance in making sure that they have the resources and services that they need. So it's not meant to be, okay, you do a transition plan, you identify next steps, and, it shouldn't just all be on the youth's shoulder to actually arrange for any services or resources that they may need. It is supposed to be a joint process, and they should have assistance in getting those services and resources established as part of that transition plan process. One of the tools that we created as part of this is a new reference chart. And this is a reference chart that I will, the next slide will give you kind of a snapshot of what that actually looks like. But we hope that it would be a helpful tool for all workers involved with older youth in foster care to be able to track kind of case management requirements. So some of the things that are actually on the reference chart is, when do you need to pay attention to the Bill of Rights? When do you need to do credit checks, the independent living skills assessment? When does NIDED come into play for individuals? What about case planning? When can the APLA goal actually be applied? When is the transition plan federally and state required? Um, when are essential documents actually needed? And discharge notices, for youth who are exiting foster care at the age of 18 or older, reentry information, as well as Medicaid information, is all part of the actual reference chart. So this is just a snapshot that you can see, and I'll just pick on the first line of this as far as indicating that two individuals to serve as members of a case planning team. That's something that should be started at the age of 14, and you see that it applies all the way through the age of 20 while they're in care. And you can see here, obviously, the transition plan, federally and state required at starting at the age of 17 and a half, but nothing says that it can't be started earlier. Discharge notices, you will see, begins at the age of 18. And, this is only a screenshot, so it does not have the entire, you know, reference chart on this screen, but please note that this document is attached to the policy that is on the OCFS website and can certainly be found there. I'll just mention again, the policy was issued January 30th of this year, and it is the first ADM of 2024 that was issued, and you will find this as a link in that policy. Certainly, I would strongly suggest for workers to, download this, to print it out, to post it in your cubicles so that it is a reference chart that is readily available. We're getting into now just kind of a snapshot of what the actual new transition plan document looks like. And, I'm not showing you the demographic page. This is, starting at the part one of the checklist. And again, it is just a screenshot of it. There are actually 10 different item numbers as part of part one of the checklist. Right now, you're only seeing 7 on the screen. There are brief instructions at the top that this, is if there's an area that has not been discussed or a document that has not been obtained, then the checkbox for the county agency obtained and the youth um, has access, this column would be left blank. The next column is to be used only when the youth actually has possession of the document. And the last column could be NA unless it is blacked out. So looking at this first item number here, which is around photo identification, could be a learner's permit, could be a driver's license, could be just a state ID card or something other that would be a photo identification. I will strongly state that it should not be from a photo ID from a voluntary agency. It should be some sort of state issued, government issued photo ID for youth. And so what we're talking about, if this is being started at 17 and a half and this has not been obtained, this checkbox would be blank here and you would not be checking anything here. And we would not be initialing anything because it's not in the youth's possession. But this is not an NA category because every youth should be leaving foster care with photo ID. So it is a requirement. It's one of the essential documents. So at some point before they exit foster care, this document needs to be obtained. So until that happens, this box would be left blank and you would revisit it at the next review and update to make sure that, okay, is this still an outstanding issue? If this is blank when conducting the initial transition plan, it becomes part of next steps of what has to be completed. And it may be completed before you get to the point of them, before the 30 days when they turn 18, which is fine. And then you can fill it in at that point to complete it at that point. And it may be that they don't have it in their possession, so this still maintains as a blank. But whenever it's actually obtained by the county or the agency and the youth would have access to it, that box would then be checked. And you would not have a youth initial until it's actually confirmed that it's in their possession. So that's the process of how this would look. Same with the birth certificate, whether it's original and or a certified, officially certified, not a actual just photocopy of a birth certificate, because a photocopy of a birth certificate does not help a youth. Birth certificates can be obtained for free. If there's any question about that, there are resources and policies available that we could also send to you if you're needing that. Social Security card is another essential document, and so you will see that this is a NA as well, listed as being not an option to not have available at some point. And then obviously it continues down with different item numbers of green card, tribal documents, annual credit reports that should be taking place from the 3 credit reporting agencies. So every year, all 3 credit reporting agencies should be contacted for each youth. And that is TransUnion, Experian, and Equifax is the third one that should be obtained. So this provides a place to actually put in the dates of when those are received and to check off when they're actually obtained, and the youth would have access to see that report. And then there's Medicaid card as to whether or not they have that and or a health insurance card. And there are 2 additional items. I believe one is related to education and the other is related to individuals who need to register at 18 for the draft for military purposes. This is a snapshot of part 2 of the checklist. This is more about kind of information gathering and making sure that the youth has knowledge and understanding of a particular area. Healthcare proxy is a requirement to make sure that the youth has actually chosen a healthcare proxy. So once that has actually taken place and they fully understand what a healthcare proxy is, you would be checking, or the youth would be checking off that this is actually complete. Because I'll point out to you again that all of these statements, all of these item numbers start with I have a healthcare proxy. I have discussed my post-discharge Medicaid coverage with my worker. And that they know that they can have Medicaid up to the age of 26 if they're exiting foster care at 18 or older. That they know how to actually obtain and access immunization records. That they understand that they have a right to access sexual and reproductive health care. They know how to access that care when it's needed. They understand what a copayment is, a deductible. They understand how they need to register to vote. And information potentially, like if they move from one setting to another, they need to understand that they would need to re-register to vote. They're given instructions on how to register actually for the military and depending on obviously their age for that category. Any of these from part one or part two of the checklist, if they are left blank, there is going to be a next steps and task section that would be completed to make sure that there's, items and, steps identified to address what is left blank and make sure that it is completed. Each specified topic, and I'm starting here with housing, is laid out in the same way. It is also, again, in youth language. So when they're reading this, they can answer, I plan to live in X place. And it is absolutely okay if they don't actually know at the age of 17 and a half, or if starting earlier at 16, that they wouldn't know where they're going to be. The intent here is also to make sure that they're given opportunities to understand what is actually available. So it's the reason why you see the pick two additional housing options to explore. It doesn't mean that we wouldn't be adhering to their first choice of I plan to live, but it's also giving them information about what else could be available to them. We do ask for contact information for those individuals about where they actually would plan to live. Some of the reasoning for that is also related back to NIDed information. Um, and so that we would be able to follow them once they exit foster care and be able to reach them to continue to collect outcome information when they turn 19 and 21. It's not solely obviously just for NIDed. It's always good to know potentially where a young person says that they're going to be leaving to and how to get in touch with them as well. We've included here information about kind of their estimated total cost for housing. We have had many conversations with youth who do not have a sense of, what it actually will cost them once they actually exit foster care, because they haven't, no different than any other young person, haven't had to be responsible um, to pay for these things on their own. Hopefully, with increased use of supervised setting programs in the future, we'll see more of youth becoming, involved in paying for partial parts of rent, utilities, cell phone, and everything if they're in a supervised setting program moving forward. That's one of the goals for supervised setting programs, is to allow youth to, with a safety net, to begin to kind of experience what it's like to have to be responsible for these types of things. But the next question here is whether or not can I afford my choice of housing? And certainly they may not know at this point. They may say, oh yeah, and they could be fully believing that they can afford it and they could check yes. We're not here to talk them out of, what they think the perspective is, but we're here to, try and guide them and ask questions of, you know, then where does, we've already identified your expenses. Where does your rent of $1,500 a month come from when you know that the young person sitting in front of you doesn't have employment yet? So it would be good to ask those questions for them. The other thing that we've included in the housing section specifically here is about other housing programs that could be available to them. Obviously, there are different housing voucher programs. Every county can enter into a memorandum of understanding with their local public housing authority and hopefully be able to access some of the voucher programs that are available to youth who would be exiting foster care. The New York City Housing Authority, NYCHA, is strictly New York City. So for anybody who is in upstate youth, that would be an NA. And again, the supportive housing part is also New York City only. So that would be an NA. But the first one on this line is Housing Choice Voucher Program. You will find some of these information in the resource guide as well as in the glossary. There's more information that would be able to be collected from those two resources. So continuing on and taking a look at just what the housing section specified topic looks like, we have the rating that is for the youth, and we do, put it out here to asking them to be honest with themselves. Won't do them any good not to be honest with themselves, indicating from a scale of 1 to 5, they're not ready or they are fully ready to live on their own. And based on anything that was indicated in the previous slide, um, as to where they were at in trying to find housing, there may be next steps that need to be addressed. We've provided kind of an example that maybe they need to create a budget to understand what their actual housing expenses would be. You will find examples in every single specified topic section. So if it's education, if it's family planning, there is an example in the next steps and task kind of sections. For each one of the specified topics. And that may be a real example to actually list as a next step for that individual, but it's meant to just kind of be a guide and help, kind of move the process along. But maybe they need specific help on, if one of their options coming back here was that they, plan on wanting to explore what it's like to maybe live in a college dorm room as one of their additional options. So they wouldn't, a next step would need to be created as a result of that as to who's going to help that young person do that. And when is, the anticipated completion of that. And then when it is actually completed, it would be checked off. The youth can list any additional comments in every single section of the, different 7 specified topic areas. There's always going to be a place for them to talk about whatever their comments may be on the particular area. At the end of the initial um, transition plan, there is a signature page. Again, this is strictly just a screenshot. It doesn't include the actual signature piece of it, but it does have also a place for an overall preparedness for discharge. Again, this is meant to be done by the youth to get a sense of, where do they see themselves after doing all 7 sections, the 2 different parts of the checklist, where do they think their preparedness is to be discharged? And again, it's not meant to be what the worker thinks. It's not meant to be what the foster parent thinks or an actual parent or other caregiver to rate where the youth actually is in this area. It is all meant to be just what the youth actually thinks their preparedness is. For ease, we have included kind of a place to record all 7 sections so you can see it as a whole. That's the only reason that this is here, is just to make sure that it can be seen as a whole and as a reference moving forward for review and updates to come back and say to the youth, look, you've been able to move from where you thought your preparedness was around housing. You only thought you were a 2 when we first did this. We're, a year down the road and, you've now rated yourself differently because you will find ratings in the review and update section as well. But this is meant to be a place where it's just put down so that they can see it as a whole from the initial transition plan. This is a snapshot of the 6-month review and update part. So you'll see that obviously we're listing out basic information as far as name, date, and then age and date of when each review would be completed. Again, it does walk through all 7 sections, and each, I will also emphasize that checklist part 1 and part 2 would be revisited if there were blanks and information that still needed to be completed from the checklist. There's a place to continue different tasks or steps that might have been listed from the initial plan, and any new ones that need to be created now that we're 6 months, a year or so down the road. And now again, a rating place for them to indicate where they see their preparedness. And that's going to be the case for each of the 7 different sections. But I do want to emphasize that the checklist part of part 1 and part 2 would also be reviewed at the 6-month review and update as well, because any blanks definitely still need to be addressed, because if they don't have a birth certificate, if they don't have a state ID, if they don't have knowledge around a healthcare proxy, um, or how to access community resources, those are things that still need to be ongoing until they are actually discharged. We've mentioned before that this is not a document that is embedded within the Connexions system, but it is a document that actually does need to be uploaded to Connexions. This is just brief kind of directions as to how to do that. There is, I believe, a Connexions tip sheet out there. We have put a link in the policy that was issued on January 30th. So that's again ADM number 1 of 2024. And you will find a link that you could go to, but this is a quick snapshot that it would start in the FSS stage. You would link it to the photo doc window, and you would choose the category of independent living. And I want to end here in kind of re-emphasizing once again why the youth voice matters in preparing them for their discharge. And this quote is, I think, probably one of the better ones is, feels like there have been meetings and conversations without us, and we don't feel as involved as we need to be. If we don't involve the youth in their own planning, we are not going to see the outcomes improving for our youth who are exiting care at 18 or older, and potentially particularly those youth who are exiting foster care with a permanency planning goal of APLA and discharging out onto their own. Every single youth, whether going home, whether going to a relative, whether going to adoption, whether being released out onto their own at 18 through 21, and certainly even before that, should be able to have a voice in what their plan actually looks like. Don't leave them out of a conversation, because then they don't know what that plan actually would look like, and it won't be successful because they haven't been a part of it. So with that, I'm going to now basically turn it over and see if we have any questions. I will say you can put them in the chat. You can raise your hand and we can see if we can unmute to take questions. And I'll turn to my staff who might be monitoring anything in our chat to see if there are any particular questions.
Hi, Carrie. Yeah, there were quite a few questions in the chat, and Ken and I did our best to answer quite a few of them. People do have the opportunity to unmute themselves if they do have questions. So we can go to the chat, or if anyone wants to raise their hand and unmute themselves, we can do that as well. And there is the link to the ADM in the chat. I can post it again, and then that has the hyperlinks all there. Thank you, Kendra. I see that you just posted that in the chat. Thanks.
Any particular questions that or confusion on anything that we could answer while we're on the WebEx here today?
I have a question.
If you could identify yourself, because I unfortunately can't see when I'm sharing my screen, that'd be great.
Sure. I'm Carla Lang. I'm an assistant director in the Child Placement Bureau in Suffolk County, in foster care. And I'm looking at this form and I'm wondering to myself, is this to be prepared handwritten or in a computer with the youth? Is the youth going to sit with the worker and kind of go through it on a computer? Or is the worker going to print it out and bring some extra pages and bring it in the field with them to the youth's residence?
We haven't specified anything as far as the process of how that would be done. So it's really about what works best for the individual. So if it is to kind of, email it, if, the youth has an email address, which I'm going to stress, we would love to see all youth, certainly by the age of 18, having an email address. You can do it that way. If it's about sitting with the youth, um, elbow to elbow and doing it on paper and pen, that's fine. If somebody, wants to sit with them and you draw it up first just with paper and pen, and then that you want to type it up, that's fine. So whatever ends up happening, we didn't specify that. The only thing that I will say, if you're handwriting it, it needs to be legible. So if you find that the youth has been the one who's filled it out the most and you find that it isn't really legible, you might want to be sitting down, making sure what it actually says. So it can be maybe typed up and turned around and given to them, 30 days before they're 18. So everybody can see what has been created for them.
Carrie, some folks are asking, is the language to be written typed using first person?
No, we didn't necessarily, I mean, it's, obviously all of the document is in first person. Um, it doesn't have to be typed up that way. I mean, next steps that are created are just the next steps. So if it's about, if they need to locate an apartment, it's find an apartment. Who's going to do that? You got to designate who's going to be doing that particular issue. And it could be the youth. It could be the youth along with a foster parent. It could be the youth along with a worker. But it has to be identified at least, who's responsible and what the actual task is.
Carrie, we also have two other questions. For the supportive adult, can it be a VA staff chosen? I like to ask that they do not pick a paid staff, but I see this more and more often.
I'm sorry, could you repeat that one?
Yep. For the supportive adult, can it be a VA staff chosen?
It depends on whether or not that supportive adult is actually going to be somebody, is that a short-term person? Is that a long-term person that's going to be available to that youth? We've often seen that workers are identified as the supportive person, and that's why we always see kind of that percentage in NIDA data that looks to be very high at 92%. I have a supportive adult because they are living, as we saw, in congregate care level more often at that age. So they become connected with potential different staff members. But is that staff person going to be there for them when they're 23, when they're 25, when they're, 21 and just leaving foster care and, now need help in applying for college or a vocational program? Who are those people? And they could have, I would hope, more than one supportive adult because, the supportive adult person could serve different purposes.
Carrie, there's another question about what about youth that are resistant to participating in this process?
That would need to be documented that they, are not wanting to be involved, and that would have to be clearly put into the progress notes FASP, as well as then listed on there is a place, I think, on the signature page to, for the youth to sign, and it could be listed that the youth did not wish to participate. Now, again, I point out that this is not a one-time kind of an event, so there should be repeated conversations taking place, and they don't need to be formal. It doesn't need to be, hey, we're sitting down today to do the transition plan. It should be informal conversations about, what do you see as your, place of where you're going to live when you leave foster care? Do you see yourself going on to, a vocational program? Do you know what vocational programs might be available to you? I mean, keeping it more simple versus the, oh, we got to do this form together.
Another question we have is, are all the documents available in other languages?
It is our plan to have the documents put into other, all of the identified languages. And I don't know all of them quite honestly offhand, but yes, it is our plan to work with our public information office to do that. I will point out that if you have additional questions that you're just not thinking of right now, you certainly can reach out to me. And once again, I'm Kerri Barber, and that is KERRI .barber at OCFS .ny.gov. If you send an email off to a different Kerri Barber, you're going to get somebody out in the western part of the state.
Just to address, a lot of people have been asking if they can get a copy of the presentation or if it's being recorded. And the answer to that is yes, we do have it being recorded, and we will send the PowerPoint out.
We are likely going to be posting the PowerPoint on the OCFS website. And, when we do that, we certainly can notify the people that were sent this meeting notice. But for anybody who was forwarded this email notice or this webinar, you may not know or get the actual PowerPoint that way. So please note that you'll be able to find it in the future on the OCFS website. Any other questions?
Hey, Kerri, it's Kim, the Essen Region 1. I know I had asked you before about like the 6-month review and like the readiness scale and stuff like that. I had to step away for a second, so I do apologize if you did cover this. But with the updates, are they clearing it out each sec time and then just updating it with the information?
Yeah, you would basically either choose, depending on what the steps were identified in the review and update, you're either going to continue that or you're going to be basically, printing off a new, part of that form and starting with new identified strategies that need to be addressed.
Thank you.
Hi, this is Kimberly Schurz from the Legal Aid Society. Thank you so much for the presentation. This was very informational. I know that you said that if we're not on the original list of emails that went out about this training, that it'll be posted online. But I know that tends to take some time, and given my focus on working with adolescent youth, I would like to have access to the training at the PowerPoint sooner rather than later. So whom can I reach out to get a copy?
You could reach out to me.
Okay, thank you so much. I appreciate that.
Kerri, we do have a question in the chat. Is there going to be any in-person trainings, and can we get a list of resources for kids when it comes to housing, et cetera?
We certainly can, do some technical assistance individually with counties and or agencies. If you're looking for something specific like that, please send me an email. My team is made up of 6 or 7 people. So, know that that would be covering statewide. We will do our best to obviously address any of the individual needs as best as we can. I'm sorry, what was the second part of that, Heather?
I'm just asking for a list of resources for youth when it comes to housing, et cetera.
So one of the good things that was created as part of this process and part of the policy and the transition plan is the resource guide, as well as the glossary. So a lot of different resources can be available right in the resource guide and with the links available to some of those resources.
Carrie, I was just thinking too, maybe we could mention that we are looking to update the transition plan training provided by our folks at PDP.
Yes, that's in process. So anybody that might have currently have scheduled transition plan training, you might see that those are going to be postponed temporarily until we're able to revise the curriculum to obviously, address the new template and documents available because the previous ones should no longer be utilized. We still have around 15 minutes, but I understand that if, right now there are no more questions, we can end here and give everybody 15 minutes of their day back. If there are additional questions, certainly feel free to put them in the chat. We will do our best to address them and get back to you on those questions.
Hi, Carrie. This is Brandy Gwynn. I'm Chenango County Foster Care Supervisor. Do you have any suggestions for requesting birth certificates from other states? I looked at the link that you had sent. Somebody had put the link in for the birth certificates, and that was talking about requesting birth certificates if you were in New York City versus out of New York City. It didn't say anything about requesting them out of state. I have a youth, a teen. We have been trying to get a birth certificate from the state of Texas for about a year now. Um, Without his birth certificate, we cannot get his social security card. Without any of that, we can't get his driver's permit. And we have been trying for a year to work with Texas and keep running into roadblocks.
Okay. I will point out that on a, federal Children's Bureau website, there is actually a listing of all states' independent living coordinators and education training voucher program managers. If you're not able to find that, we certainly can reach out to the identified person in Texas and see what their process is for obtaining birth certificates in that state.
Right, when you said Federal Bureau, are you referring to the Children's Bureau?
Children's Bureau, yes, that's what I think I said, and if I didn't, I apologize. The Children's
Okay.
Bureau.
So you're saying that they have a list of
They have a list of all
living.
states and contacts for independent living as well as education training voucher programs.
Okay, thank you so much.
Carrie, we have a question in the chat about how should we document when we have severe MR autistic kids who are too low functioning to understand our nonverbal youth.
You would document it actually in progress notes. You would document it again in the FAST and actually on the form itself on the signature page.
The follow-up to that is so you complete the form for them.
You wouldn't be completing the form for them. You might have a lot of blanks unless indeed you can truly check off that there's an ID or the social security number. But if it's never going to be in their possession and they can't sign off on that, that column is always going to be left blank. Unless you're going to write in that it's in the possession of a guardian caregiver for that individual. If no other questions at this time, I thank everybody for joining today. This has been an amazing showing of individuals for this topic area, which also shows the importance, obviously, of helping improve our outcomes for our older youth exiting foster care and for our older youth in general in foster care. So thank you for your focus and attention on this particular topic.